In the late summer of 1576, the high valleys of central Mexico began to fall silent. Entire villages that had once been filled with markets, farming, and daily life were suddenly overtaken by a mysterious illness moving with unsettling speed. Families watched relatives weaken within days. Communities struggled to understand what was happening around them. Within months, the disease would spread across large parts of New Spain, leaving fields abandoned, towns depopulated, and colonial authorities overwhelmed. By the time the epidemic subsided, millions of people were gone, making it one of the most devastating disease outbreaks ever recorded in the Americas. The catastrophe unfolded during a turbulent period in Mexico's history. Only a few decades had passed since the Spanish conquest of the Aztec Empire in 1521. The new colonial system had reorganized society, economy, and land ownership across central Mexico. Indigenous populations, already diminished by earlier epidemics such as smallpox and measles introduced from Europe, were living under heavy labor demands within the colonial tribute system. Agricultural production, mining operations, and urban construction relied heavily on indigenous labor. These conditions created an environment in which communities were densely settled, economically strained, and vulnerable to disease. During the summer of 1576, reports began to emerge from the Mexican highlands describing a sudden and severe illness affecting indigenous communities. The disease was known at the time as Cocoliztli, a Nahuatl term broadly meaning pestilence or plague. Colonial physicians and administrators struggled to describe its symptoms and causes using the medical knowledge available in the 16th century. According to historical records, the illness often began with high fever and intense weakness. Many patients developed severe thirst, dizziness, and headaches. Some accounts described bleeding from the nose or mouth, and in many cases people deteriorated rapidly over the course of several days. The speed of the illness and its wide geographic spread created fear and confusion across the colony. One of the most important contemporary descriptions came from the Spanish physician Francisco Hernandez, who had been sent to New Spain by the Spanish crown to study the region's natural history and medicinal plants. Hernandez and other observers attempted to document the symptoms and patterns of the epidemic, though their understanding was limited by the medical theories of the time, which still relied heavily on ideas about bodily humors and environmental imbalances. What became clear very quickly was the scale of the crisis. The epidemic did not remain confined to a single settlement or region. It moved across central Mexico's densely populated plateau, affecting towns, villages, and agricultural communities. The highland regions surrounding present-day Mexico City, Puebla, and Oaxaca were particularly affected. Colonial officials recorded alarming mortality rates. In some communities, large portions of the population died within a few weeks. Churches and colonial administrators attempted to keep burial records, but in many areas the number of deaths became too large to document accurately. Labor shortages soon disrupted farming, transportation, and mining operations. The epidemic arrived at a time when the indigenous population of central Mexico had already experienced dramatic decline. Before European contact, the region had supported tens of millions of people. By the mid-16th century, successive waves of introduced diseases had already reduced that number significantly. The 1576 epidemic struck a population that was already weakened by decades of social disruption, economic pressure, and previous disease outbreaks. Environmental conditions may also have played a role in the severity of the outbreak. Historical climate reconstructions suggest that the mid-1570s followed a period of prolonged drought in parts of Mexico. Drought can influence disease transmission by affecting water supplies, agriculture, and food availability. Malnutrition and displacement may have weakened resistance to illness in already vulnerable communities. At the time, however, the causes of the epidemic remained a mystery. Colonial physicians proposed various explanations based on prevailing medical ideas. Some believed the disease resulted from corrupted air or environmental imbalance. Others suggested that unusual weather conditions had altered the natural environment in ways that produced illness. The Spanish colonial government attempted to respond to the growing disaster, though their ability to intervene was limited. Hospitals established for indigenous patients struggled to care for the rapidly increasing number of sick individuals. Religious institutions also played a central role in the response, as priests and missionaries traveled between communities administering last rites and attempting to provide spiritual support. The epidemic's effects were particularly severe among indigenous populations. Historical accounts consistently indicate that indigenous communities suffered far higher mortality rates than Spanish settlers or people of mixed ancestry. Several factors likely contributed to this disparity, including living conditions, labor demands, and possible differences in prior disease exposure. Many indigenous communities lived in densely populated settlements established under colonial resettlement policies known as reductions. These policies had concentrated previously dispersed populations into centralized towns designed to facilitate taxation, religious conversion, and administrative control. While efficient for colonial governance, such settlements could also accelerate the spread of infectious diseases. Economic pressures also shaped the epidemic's impact. Indigenous workers were heavily involved in agriculture, construction, and mining operations that required long hours of labor. Malnutrition, exhaustion, and limited access to medical care could have increased vulnerability to disease. Meanwhile, Spanish colonists often had greater access to resources, food, and medical attention. As the epidemic continued through 1576 and into the following year, colonial authorities faced increasing concern about the colony's economic stability. The workforce that sustained agricultural production and mining was shrinking rapidly. Some estates and agricultural lands were left without enough laborers to maintain harvests. Tax revenue declined as communities lost large portions of their population. The demographic consequences were enormous. Modern historical estimates suggest that the epidemic may have killed between 5 and 15 million people across New Spain during the late 16th century outbreaks of Cocoliztli, including the major epidemic of 1576. Exact numbers remain uncertain because population records from the period are incomplete, but most historians agree that the mortality was among the highest ever recorded in the region. Entire villages disappeared from colonial records during these years. Archaeological and historical evidence indicates that many settlements were abandoned permanently after the epidemic. In other areas, survivors relocated to nearby towns, reshaping settlement patterns across central Mexico. The long-term demographic effects of the epidemic reinforced the transformation already underway in colonial society. As indigenous populations declined, Spanish authorities increasingly reorganized land ownership and labor systems. Large estates known as haciendas expanded in some regions, while remaining indigenous communities were incorporated more tightly into colonial administrative structures. For centuries, the exact cause of the Cocoliztli epidemics remained uncertain. The descriptions recorded by 16th-century observers did not clearly match the symptoms of well-known diseases such as smallpox or measles. This uncertainty led historians and scientists to explore various possibilities. Some researchers proposed that the epidemic may have been a hemorrhagic fever native to the Americas, possibly spread by rodents or environmental conditions influenced by climate changes. Others suggested that multiple diseases might have circulated simultaneously during the crisis. In recent years, advances in genetic analysis have provided new clues. Scientists studying DNA extracted from the remains of epidemic victims in burial sites in Mexico have identified traces of a bacterium known as Salmonella enterica, specifically a strain called paratyphi. This bacterium can cause a severe form of enteric fever, similar to typhoid fever. The presence of this bacterium in the remains suggests that enteric fever may have played a role in at least some of the Cocoliztli outbreaks. However, researchers continue to debate whether this bacterium alone explains the scale and symptoms described in historical records. The epidemic may have involved multiple factors, including bacterial infection, environmental stress, and social conditions that intensify transmission. Regardless of the precise biological cause, the 1576 epidemic marked a turning point in the history of colonial Mexico. The dramatic loss of population reshaped the region's economy, labor systems, and cultural landscape. Indigenous communities that had survived conquest and earlier epidemics now faced another profound demographic collapse. Yet even in the face of such devastation, indigenous cultures endured. Communities rebuilt settlements, preserved languages, and maintained traditions despite enormous challenges. The survival of these cultures across centuries reflects resilience that continued long after the epidemic had passed. The epidemic also left a lasting imprint on colonial administration. Spanish authorities became increasingly aware of how disease outbreaks could threaten the stability of the colony. Medical documentation improved over time, and colonial officials began collecting more systematic records of population, health, and environmental conditions. Historians today study the Cocoliztli epidemic not only as a medical mystery but also as a window into the complex interactions between environment, society, and disease. The outbreak occurred at the intersection of climate stress, colonial economic systems, and profound demographic change. These factors combined to create conditions in which a disease could spread rapidly and cause extraordinary mortality. Modern scientific research continues to examine skeletal remains, historical climate data, and colonial documents to better understand what happened during those years. Each discovery contributes another piece to the puzzle, helping researchers reconstruct the circumstances that led to one of the deadliest epidemics in the history of the Americas. More than 4 centuries later, the silence that settled over central Mexico in 1576 still echoes through historical records. The epidemic stands as a reminder of how disease can reshape societies, especially during periods of political upheaval and environmental stress. It also underscores the importance of studying past epidemics carefully, not only to understand history but to recognize the complex conditions that allow diseases to emerge and spread. The Cocoliztli epidemic remains one of the most significant demographic disasters of the 16th century. Its impact transformed communities, altered colonial development, and left questions that scientists and historians are still working to answer today. Through careful study of the past, the scale of that tragedy becomes clearer, revealing a moment when disease, environment, and history converged to change the course of a continent.